Welcome back, warriors and supporters, to CWF Presents CRPS/RSD is Real. This is a really big episode for us because guess what? We just hit double digits. This is our 10th episode, and we're so excited to have Dr. Pascal as our guest today. Dr. Pascal is located in Cary, North Carolina. He has developed his own method, the Pascal Method, of how he treats CRPS. We're going to learn all about the science and the evidence behind his method. He has a 70% success rate at putting warriors in remission. This is just remarkable and, quite frankly, very unheard of. So without any further ado, I'm going to hand the mic over to Kimberly, and let's get to know Dr. Pascal and learn about his method. So sit back and relax and enjoy episode 10.
Hello and welcome. My name is Kimberly Sigelka, CRPS Warrior and Operations Assistant with the CRPS Warriors Foundation. Today I'm really excited to talk to Dr. Pascal. So I'd like to start with asking you how you were first introduced to CRPS and started treating patients. I know you've been doing it for a long time, so kind of getting into how you first found out about CRPS and then created your method of treating it.
Yeah, that's kind of a tough question at the beginning because this is my 38th year treating patients,
Wow.
chiropractor. Yeah, starting to get the hang of it. And I always just had a real passion for being the best doctor that I could be. And that's because when I was little, about 9 years old, my dad started having headaches. And he'd go to the MD and complain, hey, I've got these horrible headaches. And the MD would go, yeah, just take some aspirin. And the headaches got worse. So he went back and he said, no, they're really terrible. And they're like, yeah, just, you have stress, work stress, life stress, blah, blah. They just, waved him off and said, just take more aspirin. And this went on over several months, and it got so debilitating that he actually passed out at work one day.
Oh, man.
And so they took him to the hospital, do a bunch of tests, do an x-ray, and they find a tumor the size of a lemon in his brain. So they said, you've got maybe 6 months. And so my dad came home and had to tell us, but he was tough, very tough fighter of a person, and lived 4 years. So I was very fortunate to have that extra time. And that's when I decided that I wanted to help other people. I wanted to be a doctor, but I wanted to be a doctor that really listened to my patients, and would do whatever it took to help them, to be the doctor that if my dad had me as a doctor, he would still be alive. So that's what I strive for every day. So when people ask me what my motivation is, that's very close to home.
Absolutely.
So I became a chiropractor because Western medicine just didn't make sense to me. Chiropractic, is using the body's own healing forces to help the body heal. And that made a lot more sense. And when I started practicing, the universe just started sending me very difficult patients. I would have, even though chiropractic really is known for like neck pain and back pain and headaches, I would get people with MS and put them in remission, people with Parkinson's and put them in remission, people that were paralyzed, all these weird, bizarre things, full body eczema, weeping, bleeding. And, I was able to treat them and get them into remission. And so in my whole practice, I just kept getting more and more difficult patients. I never really had a neck pain, back pain. And because of that, I would, back in the early 90s, you didn't really hear RSD, reflex sympathetic dystrophy, which is the name before CRPS, thrown around a lot. What you heard mainly was fibromyalgia, right? So patients would come in and they'd have all this horrible pain, And sometimes it was full body, sometimes it was just in a limb. And really, all the seminars and education was more directed. That was like the buzzword of the 90s. And I'm sure that some of the patients in retrospect that I saw that were fibromyalgia patients were really CRPS patients. And they come in, and now I have to figure out how to fix them. And I typically, as a chiropractor, you need about 18 to 24 hours of continuing education, every year. And I average more than 100. So I'm always going, always getting more information, going to seminars, going to expos where they have cold lasers and microcurrent and, magnetic fields. And, I was one of the first chiropractors, first doctors in the country. I was in that first wave of using lasers and red light therapy. And back then they're like, this is crazy stuff. And I'm like, they've been using it for 40 years in Europe. Here's 100,000 peer-reviewed research studies you might want to go look at.
Yeah.
And so somewhere along the line, I got an official CRPS patient. And then, my approach, I don't have a system. I have an individual in front of me, and they have their various symptoms. So then I do whatever I believe is the appropriate therapy for those symptoms. So some people, have full body pain. You can't even touch them. So how do you treat a patient that you cannot physically touch? Because if you touch them, they're in excruciating, unmeasurable pain. I had to figure that out, So what do? You use light, right? Like lasers and other light therapy. You use sound, different frequencies. You do what you can to calm their nervous system down enough to the point where then you can touch them. And then you do these various neurologic techniques and different treatment modalities.
I saw something on your social media about something called like a sound lounge, and I'd never heard of that before. Is that one of the things you're talking about with
Yeah,
sound?
so yes, I don't use that in particular, that machine,
Okay.
that particular machine, but like patients will come in and we'll use tuning forks.
Okay.
And some tuning forks will jack their pain up. Other tuning forks will calm them down. So you have to find through trial and error, okay, what frequency lowers your pain? Because most people with CRPS, most people think that CRPS is a pain condition because they have pain.
Right.
And so most of the therapies are addressing pain. So they do medication, pain medications, which for most CRPS patients are not effective. They do pain modalities like nerve ablation or spinal cord stimulators. And again, most of those are not effective. And so what I figured out early on is that if we're doing all these things to calm down pain and it's not changing pain, it must not be a pain condition. And what I found is, yes, the pain nerves are being fired, but it's not because of the pain nerves. It's the other sensory nerves, the light touch, the vibration, the temperature, the 2-point discrimination, the circumferential pressure, form recognition, all these sensory nerves that run alongside of the pain nerves, they are all misfiring and are overflowing onto the pain nerve.
Wow. Okay.
So it's kind of like if you've got a couple kids in the back seat of your car, parents will relate to this, and one kid starts poking the other kid, poke, 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 poke. Then finally, the second kid can't stand it anymore, and they start screaming and have a big fit. That's the one that gets your attention, right? You go, hey,
Yeah.
stop that. That's the pain nerve. The pain nerve is the one that's getting poked, that's being, the neurologic term is facilitated, being irritated by the other sensory nerves. So, of course, it makes the most noise, right? Pain. So we put our attention on that. But we've clearly demonstrated therapeutically that putting your attention on pain nerves does not get rid of pain. And then we have other factors like compromised immune system. Most people with CRPS have a very compromised immune system, usually from birth. It's just a ticking time bomb. So they have a weakened immune system. They probably have allergies, food sensitivities, even autoimmune issues, right?
Yep.
And then they have hormone imbalance for whatever reason. So now their hormones are off, their immune system's off, their sensory nervous system is firing weirdly and is hypersensitive. And so we have all these ticking time bombs in one person, and they're just waiting for that day that they have trauma, the same trauma that millions of other people get, and go, oh, I sprained my ankle, or oh, I broke a bone in my foot. That hurts in a appropriate way, right? I get my boot on or my cast, okay, take a couple of pain meds, now my pain comes down. That's what 99.999% of the people experience, not CRPS patients, right? They have that exact same trauma, and then they have excruciating, unbelievable pain. And it's because of those underlying factors. So my program addresses those underlying factors: hormones, immune system, hyperactive sensory nervous system. And when you do that, then what we've been, pretty successful at getting people in remission.
That's amazing. The fact that you have a high success rate of getting people in remission when it comes to CRPS, is like unheard of. So that's fantastic. And I just want to get your information out as much as possible so people know that you're there and how to find you, and then how to find people around them that might be able to start them on the path if they aren't able to get to you in North Carolina. So if we could talk about some of the things that you've talked about, how you calm those things down. So if you're talking about the immune system being compromised, how do you start
Right.
working with the immune system?
Yeah, so you have to work on all those things at the same time. At least
Okay.
that's my system.
Mm-hmm.
So with the immune system, I developed a technique where we can reset the immune system. And the biggest way that we do that is that we look at people's sensitivities and allergies. Because sensitivities and allergies, people go, my immune system's fine, but I have a ton of allergies. No, allergies are the symptoms of a misfiring immune system.
Okay.
So I'll give you a good example. Like, I'm not allergic to cats. I breathe in some cat hair. My immune system goes, oh, cat hair, this doesn't belong here. Maybe sneeze a couple times, send some white blood cells, gobble up whatever's there. That's an appropriate immunologic reaction for that attack of the cat hair. Someone that's allergic to cats, they breathe in that same cat hair, their immune system goes, oh my gosh, we're under attack. What do we do? Sneeze a million times, flood the sinuses, send 100,000 white blood cells. They have like a psychotic event. Their immune
Yeah.
system is having an inappropriate immunologic reaction to just a little bit of cat hair or a little bit of egg, and they break out in a full body rash, or they eat some shrimp and now they can't breathe. So, so I found a way to influence the immune system, and that is by testing a person, seeing what they're sensitive to and what they're allergic to, and then treating them for each thing. And the way that I'm influencing the immune system is through the acupuncture system, the immune system points in acupuncture. So
Okay.
simplistically, when someone's immune system's compromised and they have sensitivities and straight out allergies, they're actually not just sensitive to their triggers like dust or pollen or eggs or cats or shellfish or whatever it is. They're sensitive to 30, 40, 50, 100 things that they're coming in contact with every day that are all adding up to weaken the immune system. And then they get exposed to the pollen or the shellfish or the egg or the cat hair, whatever the tipping point is. So once we figured out, of course, that's how the immune system works. It's not like you're healthy and then you're sick. It's you have all these things that all add up, and then the immune system can't fight anymore and it crashes. So we'll take, let's say, egg. We'll have a person hold a sample of egg, and then we stimulate about 40 different acupuncture points. We don't use a needle, that's too strong of a stimulus. We use a little like vibrator type point stimulator and a laser. If we can't touch them, of course, then we just use light therapy to hit all of these points.
Okay.
And then you just do each one at a time, and then that resets their immune system. So just in terms of straight up allergy, not like CRPS, maybe 25% of my practice are straight up allergy patients. So if they eat egg, they break out into hives, or they eat a shrimp and they have anaphylactic reaction, can't breathe. And we have a 95% success rate. And I've been doing that since 2001. So however long that is, 24 years, 23 years. So a long time, hundred thousands of treatments. And so we take that system that gets rid of sensitivities and allergies, and we apply it to our CRPS patients who have a compromised immune system.
Yeah, that's fantastic.
As I'm sure you have seen in all of your CRPS patients, so many of us have so many things going on. It is our pain, but it is also like I've been diagnosed with mast cell activation syndrome, and that is all about allergies and histamine. So it's
And
all of that. So
gastroparesis is super
yeah.
common, and so
Yep.
many kids coming in on feeding tubes. And
Oh my gosh, that's hard. So once you get the immune system reset and that starts to calm down, what is the next
well,
thing
so
that
we're
you're doing?
doing
You're
this,
doing it at the same time.
we're doing it
but
concurrently, but
yeah.
here's the deal. And I don't really know any other programs besides mine that are directly addressing the immune system the way that I am. I mean, I don't know what everyone's doing, but I haven't really heard. But what heals you? Like if you have a cut or some injury in your body, what is it that heals us? It's our immune system, right? And so if we have CRPS, then what does that tell us about the function of our immune system? It's not working, right?
Yeah.
Or not working well enough. And we'll even see that after a person is done with our program, then, and they go home, they'll continue to get better because we've reset their immune system. We made a difference. So it's not just that we did some chiropractic care or laser or magnetic field or detox or this, that, or the other. We've actually changed immunologic function in the body. We've made the body able to heal. So when people go home, they continue to heal. If they have a flare-up or trauma, they recover much quicker because their immune system is in a completely different place. So to me, the biggest, most important thing that you have to do with CRPS is reset the immune system. Now, concurrently, we're looking at hormones. Okay, well, why are their hormones off? Well, their hormones are off. One of the big reasons is they're not taking in the proper nutrients, right? Because their small intestine isn't functioning well. Their small intestine is injured. Well, what's keeping their small intestine injured and inflamed? They eat foods that they're sensitive to. So as we do the immune system, that's going to help directly heal the small intestine. And of course, the small intestine is where the subproducts of our neurotransmitters are made. So our neurotransmitters are those chemicals that are carrying all the signals in our brain. Neurotransmitter, right? They're carrying the signals. Yeah. Well, those things like GABA, acetylcholine, serotonin, right? The subproducts are made in the small intestine. They go into the blood, they go up to the brain, they go through the blood-brain barrier into the brain, and then they're assembled there. Okay. Well, if your small intestine is off, you're not making then your neurotransmitters have to be off. If your neurotransmitters are off, how can you have normal linear thought? How can you have normal brain function? Because like you could have a brand new car, brand new, but it doesn't have oil, doesn't have gas, doesn't have water in it. It's not going to work. Now, does that mean the car is a piece of junk? No, it just means it doesn't have the fluids or the chemicals that it needs to properly operate. Same thing with the brain. Well, where do those chemicals, where are they made? Small intestine. Where are the signals and the subproducts for all of our hormones coming from, right? Those hormones that are coming from the pituitary gland and the pineal gland and the thymus and the thyroid and the ovaries and the testes and the adrenals. all of those precursors, subproducts, and signals are all coming from what we absorb and from the brain. So again, resetting the immune system, healing the small intestine, giving supplements to help, because if the body's not making it in the beginning, you give it some dopamine, or you give it some serotonin, or you give it, until the body can make its own. So that's how we're addressing the hormones. And then we're using machines that directly help heal tissue in the body. So red light therapy, cold lasers, we know that specific way, or that there are specific wavelengths of light that stimulate cellular repair. So a simple example of that is if someone broke their arm, they'd have to have a cast, right? And then it takes about 6 weeks to heal. But if you took a laser or other specific red light therapy and shined it on that arm for like 20 minutes a day, they'd heal in 2 to 3 weeks instead of 6 weeks.
Wow.
Yeah, we've known that for over 50 years. So that's not like debatable. That's like gravity. That's a fact. So we use, and then there's magnetic fields that do the same thing. There's certain specific magnetic fields. The Earth emits a low-level magnetic field that helps heal us, Schumann resonance, which is why when people go to the park and lay on the grass or go to the beach and sit in the sand, they feel so much better because they're getting that energy literally from the earth.
Yeah. So would like grounding mats and grounding sheets and that kind of stuff be doing like adding to that as well?
Right. That's right. Absolutely. So, and what I find is very interesting is that the wavelength that best heals us. So the wavelength is, a wave goes up and down. And if you measure from the top of one wave, right, is up, and then it comes down, and then it comes back up. If you measure from the top to the top, or the bottom to the bottom, it's the same. That's what the wavelength is.
Okay.
Okay. So some have little tiny wavelengths that are like an inch long or a tenth of an inch long, and some are hundreds of miles long. And the frequency that heals us, that wavelength is equal to the diameter of the Earth's atmosphere. So the only place that keeps us alive, which is inside the Earth's atmosphere, is coincidentally that distance is the exact same distance as the wavelength the Earth emits to help heal us.
That is so interesting.
Yeah.
Like, what are the chances? That's amazing.
What are the chances? Yeah, amazing coincidence. We're working on the hormones directly by doing magnetic fields and microcurrent and lasers and all sorts of modalities that science has proven help stimulate cellular repair. And supplementing, and of course making sure the neurology is clear. That's that chiropractic part. Our brain controls our entire body through the nerves. Sometimes those nerves can get pinched when they come out of the spinal cord. So taking the pressure off those nerves, restoring normal nerve flow, that's that classic inside the box chiropractic. That's probably 10% of my program, but have to have normal nerve flow. So now we have our immune system, we have our hormones, and then the other part is resetting normal nerve function. So like I said earlier, people with CRPS, their nerves are misfiring, right? We know their pain nerves are way, way overfiring. And I believe that's because of the other sensory nerves. So I use different neurologic techniques that I've learned over the last 3.5 decades or 4 decades, because I had to start studying way before I went to school, right? So probably 50 years of studying now. I sleep with cotton in my ear so that knowledge doesn't leak out, But yeah, then there's different techniques that we can use to help reset normal light touch, normal vibration, pain, circumferential pressure. And so we're approaching the nervous system with these various neurologic techniques. And part of the nervous system goes to your muscles. part of your nervous system goes from the body back to the brain, the sensory part, right? And it has all these different nerves. Each nerve is carrying, like pain has its own nerve, vibration has a separate nerve, temperature has its own nerve. All of these have to be reset. The irritation in them has to be cleared out. So we use different techniques that do that. And then there's a huge mental emotional component. You cannot have this kind of trauma and this kind of pain and not have it impact you mentally, right? So I'm not a psychologist or a psychiatrist. I did my undergrad from UCLA in psychology, so I have an understanding, and we have different tools in my office that help support that. So lasers help, magnetic fields, all this stuff for neurotransmitters in the brain. But we have other machines like Brain Tap. We have NeuroSage. We have several different machines that help stimulate different parts of the brain and help calm it down. But I will also work with psychiatrists, psychologists, life coaches, all with to the level of comfort to the patient, because some patients want that, a lot of it. Some people don't want any of it. Some people want some, I'll work with a life coach, but not a psychiatrist, or, so we're trying to find that balance, but but you absolutely must address the mental emotional component as well. So we're trying to have a whole global approach within our scope of practice, and to the best of our ability.
Absolutely. Goes back to what you were saying about how you are treating the whole body, and each person they have CRPS, but not everything applies to them, or different treatments might work for different people because everybody is different, especially with CRPS. Right. And you're just focusing on the person and what's going to help them, which is fantastic. I think I saw I was looking through your website and everything, and you talking about stress relief as being something that you focus on. And that is, a huge part of having CRPS is a large amount of stress. So something that I had heard previously from other people was about the vagus nerve. Is that something that you work with as well, like vagus nerve stimulators, or trying to calm that down?
Right. Yeah. So our nervous system is kind of interesting. We have our brain, right? And that's the main controller of the body. And coming out of the brain is this giant cable of a bazillion nerves, right? Our spinal cord. And so the brain and the spinal cord, that's what we call the central nervous system. And then we have branches that come off of that, like out of our neck into the neck muscles, down our arms, out where the ribs are, our low back, and those nerves are going to the organs and the skin and the muscles and whatnot. So those nerves outside of the spinal cord are called peripheral nerves. But we have another set of nerves that are coming directly off the brain. There's 12 pairs. And nerves that come off the spine are called spinal nerves. So nerves that come off the brain should be brainal nerves, right? But no, they don't call them that. They call them cranial nerves. The bones of your skull are cranial bones. So they call them cranial nerves. And there's 12 pairs of them, like to your nose to smell, and your eyes to see, and then the muscles to move the eyes, and then to your skin to feel, right? And to the muscles of your face, and then to your ears to hear and for balance, and to the muscles that shrug your shoulders and move your tongue. And one set of nerves is the vagus nerve.
Okay.
And vagus, I think it's Latin for wanderer, and it's actually the longest nerve in the body. And basically it goes to all of our organs and all of our glands, and it's basically monitoring the idling speed of that organ. Is that organ too cranked up, then it'll calm it down. And that's the vagus nerve. So when we look at CRPS, of course, these people are in pain. And when you're in pain, you're very amped up. And so let me digress a little bit. One part of our nervous system is called the automatic nervous system. It's the part of our nervous system that we don't have control over. like healing and digestion and, things like that. But MDs like to use fancy words, so they don't call it automatic, they call it autonomic. But the autonomic nervous system has two parts. One is the go, 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 which is sympathetic, right? Fight or flight.
Okay.
A lion jumps out of the bushes and goes, rah. So now we have two choices. We can either stay there and die or run or fight or run away. So when we stimulate the sympathetic nervous system, it's to fight. So what happens? Heart rate increases, respiration increases, pupils dilate so you can take in more data, right? All the blood flow shifts from our digestive tract into the muscles so we can fight or run away, flight. The opposite of that is the parasympathetic nervous system. And that is rest, digest, heal. And that's what the vagus nerve is primarily mediating. And it just gets out of whack because we're so sympathetic. And you cannot heal if you're not in a parasympathetic state. It's just like if your car has a flat tire and you're driving down the road. You cannot change the flat tire while you're driving. You must stop the car, jack it up, and change the tire. You cannot be go, go, go and heal at the same time. It cannot happen. So if people have a problem, it doesn't matter what it is, but in this case, CRPS, you have to put them into a parasympathetic state.
How do you do that?
Exceptionally well.
Such a good answer.
Well, CRPS is bad enough without being intense and serious. You can be professional and knowledgeable and address it, but being lighthearted, I think we all need a little lightheartedness. So
lightheartedness and hope. That's what we all need.
Yeah. I tell my patients that I want the most painful thing to be in my office, my humor.
That's good. I like it.
We try to do our job, but be lighthearted because the pain is serious enough. And now I forgot what your question was.
Oh, we were talking about how you would reset, how you get your
vagus nerve, right?
Yeah.
So there's a lot of different ways that you can stimulate it. I am not a fan of some of these external machines that they say are resetting vagal tone, and I won't throw any company under the bus, but most people with CRPS, one of their worst triggers is vibration.
Yeah.
So now we're going to put vibration on them to help them. That's like a lot of these clinics and hospitals believe, okay, you have pain. So the way that we're going to get rid of your pain is we're going to give you more pain until you just get over it. And there are plenty of hospitals and clinics that's their approach. And it's horrendous. These people that come to me after, they've done a stint of a month or 2 months in a clinic somewhere or in a hospital, and where all the staff is going, is mind over matter, just get over it, just endure the pain. Most of those patients end up with PTSD. They're just destroyed. And now you have a whole nother component. I don't believe in more pain. I want less pain, less stimulation. So we're doing everything that we can to calm the body down and reset how those pain fibers are firing. So vibration is a biggie. So I'm not doing that. There are some neurologic techniques. We know one technique is if you stimulate the vagus nerve and then do some type of calming thing, either a mental calming thing or an outside physical thing like laser, magnetic field, that's very effective. So how can we stimulate vagus nerve? Well, the vagus nerve innervates the soft palate. So right behind your front teeth, that's really hard. There's bone there. That's a hard palate. But if you go back behind the front teeth about an inch and a half way back. It's soft there. That's the
Yeah.
soft palate. If you take your tongue and touch it, the tip of your tongue, like that, if you can feel the tip of your tongue, the way that you're feeling it is the vagus nerve. That's the vagus nerve that is innervating the soft palate. So
Okay.
you can stimulate the vagus nerve just rubbing your tongue on your soft palate. Also, the vagus nerve goes to the muscles of swallowing. So we can stimulate the vagus nerve by swallowing, which is one of the reasons why a lot of people with CRPS have a problem with swallowing, because their vagus nerve is jacked up. And there's other things, various techniques like that that will help stimulate the vagus nerve. There's different machines like lasers. There's certain settings that have been shown to help calm vagal tone. There's microcurrent, frequency specific microcurrent that'll do that. There's magnetic fields that do that, diathermy. There's, like in my office, I don't know, I have about 35 different treatment modalities. People
Wow.
always reach out on social media and they're like, well, what modalities do you have? And I hate that question, because then that makes it like, well, it's the modality. I was like, oh,
Right.
Tiger Woods, what golf clubs do you have? I'll use your golf clubs. I'll be just like you.
Right.
Oh, Michael Jordan, I have a basketball. You have a basketball. We're the same. It's, yes, you need the tools, but it's the application. You know, hey, I have the same paint set as Picasso. I have the same spices as Gordon Ramsay. You know, it's not just the tools. It's what do you use? When do you use it? How do you use it? That,
How they're applied.
unfortunately, you can't, it's not a cookbook. You know, I can't just give the doctor down the street, oh, here's my recipe, because everyone's an individual, you know, and
Right.
what works perfect for one person would be horrible for someone else.
Right.
Unfortunately, because it'd be great if I could just make a little program that everybody fits in. But CRPS has multifocal causes. Each one has a different percentage influence, and you have to handle the person as an individual. And each individual changes every day. Like in my program, people come and stay, and they're going to stay for 3 months on average. Okay, some people come for 6 weeks. Some people end up staying here for 6 months. I mean, everyone's in a different condition, right? And I am seeing them twice a day, Monday through Thursday, and then again on Friday. So 9 times a
Wow.
week. And they'll come in and they'll stay an hour, 2 hours, you know, twice a day. And if they're really bad, then they might just stay the whole day. We'll just put them in a room until they get calm enough so that they can just come in twice a day or 3 times. And I have an overall plan, but each time that patient comes in, we're reassessing. So when you come in on Monday morning, okay, I know what I want to do. Hey, how you doing? Well, now I might have to shift it. And then you come back in the afternoon, okay, how'd you respond to what we did this morning? Oh, that made it better, or didn't change, or flared something up. Okay, we change again. It's like driving on the freeway. You don't, okay, I'm going to drive from where I live to Cincinnati. I'm just going to get in one lane and go straight at 60 miles an hour. That doesn't happen. It's nonstop speeding up, slowing down, changing lanes. And that's what you have to do. You have to micromanage CRPS to be successful.
I mean, that makes complete sense, but it's not found very often of what you're talking about. And that's,
Right.
I think, like, if people hear that they come stay, they might have a question of like, are they staying at your facility? Are they finding housing nearby? What is that
Right.
situation?
So I just have a regular clinic. So people will come and they'll stay in a hotel or an Airbnb. Some people will come with their motorhome and stay at a park. You know, I'm in Cary, North Carolina, which is right next to Raleigh. So it's a big growing 200,000 people city. Only had 30,000 when I moved here.
Mhm.
So, but there's a zillion hotels, of course. you're going to need a hotel that has a little kitchenette in it, right? Because you can't eat out
Yeah.
every meal. But like there are at least 50 hotels within 10 miles of my office. And what we want is for people to stay within really ideally a 5-minute drive because they're doing that drive 4 times a day. They come in the morning, they go back to rest between treatments, they come back in the afternoon, they go back. So this person that goes, oh, I'm only 15 minutes away. Oh, now you're in a car for an hour a day. Or they go, oh, got this great deal on this Airbnb. It's only 30 minutes away. Oh, yeah? Now you're in a car for 2 hours. That's not healing,
Yeah.
right? So we make a really big deal of this. Like you need to stay close. Like there's a Sonesta, which has little kitchenettes. They just completely remodeled it. It's maybe 3/4 of a mile from my office. So it's perfect place, fairly inexpensive, has everything, and it wasn't built in, well, it's probably built in the 80s, but it's all brand new, So we want people to stay in a place like that. And we understand that it's tough, like, oh, I have to go and stay. Well, what do you think people do when they go to the Mayo Clinic? Not everybody lives in Minneapolis or wherever the Mayo Clinic is, right? Or Duke, which is right down the street from me. People come from all over the world to Duke. Same thing with me. We have people come literally from all over the world, everywhere, but I'm still waiting
Wow.
for like a penguin with CRPS or busted flipper, you know, but from Australia and Africa and Asia and all over Europe and South America, North America.
Wow.
And I understand that, people say, well, it disrupts my life to come and have to stay there for 2 or 3 months. I'm going like, well, what's CRPS doing? And then another big factor, people go, well, does insurance cover it? And, I understand that because people pay a ton of money for insurance and they expect for insurance to cover their care. And insurance does cover care, but there's no care that insurance accepts that fixes CRPS. I mean, 20% of the people with CRPS get better with medication or medical intervention.
Okay.
That's true. But the 80%, and I'll be generous in these numbers and say it's 80-20, maybe it's 10-90, but we'll say 80-20. So I never see that 20% because they got better by their MD wherever they live, right? I only see the 80% that Western medicine says nothing can be done about it, right? And with those people, we have a 70% success rate. So if you threw in the other 20% that I never get to see, you could say I have a pretty high success rate. But
Absolutely.
with the worst of the worst, we average 70%. And what does work is micromanaging the nervous system, which, a lot of policies will cover chiropractic like once a week, not 9 times a week, right?
Yeah.
They'll, but they don't cover lasers or light therapy or magnetic fields or, microcurrent or, vibration boards or, all sorts of these other things that we have. They just don't cover it. I wish they would, but they don't. So that means people have to come, they have to stay for a while. They have to pay out of pocket because insurance companies are not going to cover anything, which is why I'm seeing them so often. So we're cramming in a year's worth of care in a couple months. And
Wow.
that is one of the reasons why we have such a high success rate is not only our global approach, but the micromanaging and then the intensity of all of this care all at once. That's what it takes to get CRPS into remission.
If people are concerned about the money aspect of it, can I just ask, is it something that like you kind of talk to them and create a program, give them a general estimate and they have to pay? There's treatment plans where you have to pay ahead of time, or is it something that like it changes because it's an individual, so your treatment plan might change, the length might change, and it's something that you then have a payment plan afterwards.
Right. So the length of time, I don't know. I can say on average, it's 3 months, right? Everyone's an individual. Right. But the cost is pretty much a flat rate, because what I found decades ago is someone comes in and I say, okay, you need chiropractic and this one modality, right? And it's going to be X number of dollars. And then I'm treating them, but they're not making the progress that they need to make. So I say, hey, I'm sorry, but your condition's more serious than we thought. So we need this other modality. So it's going to be another $50, let's say. And then they go, ugh, I don't want that to pay that other $50 for care. So then it takes much longer, or we never get there. And then they blame me, right? For not getting them better. So what I decided is I didn't want someone's care to be dictated on their specific pocketbook. So I picked a number that I felt was fair. And then, and it's a decent, I mean, it's expensive, but then I do whatever care that I want. So if I'm doing some therapy and then I go, hey, I want to add one more thing, or I want to do two more things, I'm going to take this out and add this, I don't have to go to the patient and go, oh, let's reassess your finances. So every day we're giving more care than they're paying for, just as a flat base. And if I want to do even more, because that's what the patient needs, I don't have to have it dictated by, we don't have to have another financial conversation.
Which only adds stress too. Financial
Right.
conversations normally it's
right.
not going to be healing. So having a flat rate makes sense.
Right. So we have, like, our first month is one price, but then it significantly drops for all the subsequent months. So because most of the work that I do is in the beginning, not only thinking and coming up with a plan, but getting that patient acclimated to what I'm doing and my vision of healing. Like we talked on this call, people go, yeah, I understand. No, most of them don't understand until they're in it and doing it, and they get insight to, oh, well, this is why he does it this way. This is, because some things on the surface look counter, like, why that looks backwards, why is he doing it that way? But once you experience, you go, oh, okay, I get it now, So that's how we do it. And then in terms of care, some people are fortunate that they just straight up have the money. Other people have assets that they need to sell, right? Other people don't have those things, so they do fundraisers. They do fundraisers through their church, through their community, GoFundMe pages, different organizations that have monies that, they're able to donate for part of the care.
When you're talking about it, you're talking about like the 360-degree care, and you're testing for things that people are sensitive to. And so are you also giving them kind of a diet plan, changing how they eat if they don't already eat the right way? Or is that something that you don't really focus on? I was just curious on that.
Yeah, we give that some talk. We don't give them their own plan. When we do treat their allergens or their sensitivities, part of that is whatever we treat someone for, they can't eat it for a day. So like if I treat you for eggs, then for the next 25 hours, you can't eat any eggs or chicken. So we're kind of impacting it that way. But also we're like, hey, if you're eating processed foods, if you're eating foods that are full of chemicals, you're hurting yourself. You're taking longer. So just like sleep, some people go back to their hotel and then or they don't go back in between, right? So they're finished with their morning session, let's say 11 o'clock. They're not going to come back until 3:30. So in those 4.5 hours, they're going to, I'm going to go shopping, and then I want to go to the museum, and then I'm going to go to the bookstore, and I'm going to go to see my friend. And that's not healing. I mean, it's nice to do all that stuff, but that's not why you're here. You're here to heal. And so it's extremely important that when you're not in my office getting care, that you're resting. Because resting, remember, we got to move you into a parasympathetic state. So a lot of things that I do move you into parasympathetic state, but now you have to be in the parasympathetic state to heal. So while you're bored out of your mind in your hotel room, you're healing.
Hmm.
There's extreme value there.
Are there things that you recommend for people who, because I mean, CRPS sleep is such a huge, the flares happen at night. We have a hard time sleeping. It's really hard to get rest or heal when you can't sleep. So
That's true. And so in the
yeah,
beginning, it sucks,
yeah,
right? When someone comes to me, everything is off the chart pain. Every sound, smell, noise, touch, you know, they're just everything's fired up. That's why you've come to see me. And
Mhm.
so in the beginning, it's tough. It is tough. But as we start healing your body and calming things down, then you're going to be able to get better rest, better sleep. You're sleeping way better after 2 months of care than you are after 2 days of care.
Right.
So in the beginning, it's tough, but the whole idea is to move you, just like when you're in pain all the time, how, that is all consuming.
Yeah, all you think about
Well,
is your pain.
right. But if we cut your pain in half, or by 70%, 80%, as that comes down, then you're able to get better sleep. You're able to have more quiet time. You're able to spend more time, more parasympathetic than sympathetic. And it just all works together.
Okay. One thing I wanted to ask you about is if you do anything with like the vascular system, like how the color change and all of that happens and the temperature, is the vascular system part of something that you work with?
Well, sure. We need blood going to our tissues, right? And one of the hallmark things that we see is all the skin discoloration. But what is causing that skin discoloration? It's being changed because the vascular is being changed. Well, our arteries, which are carrying blood from our heart out to the body, they have three layers of, like that hose has an outside protective layer, it has an inside layer where the blood is in contact with, and it has a middle layer, and that middle layer is muscle. So yeah, that's very
Yeah,
cool. It's
it
almost
is.
like it was a planned design.
Yeah.
Sarcasm if you missed it. Uh, Remember we went back to that sympathetic fight or flight. So we need more blood into the muscles. So how does the body do that? Doesn't have like a traffic guard going, all right, all the blood go this way now. What it does is the muscle wall in the muscles relaxes. So now the artery, I'll use one hand instead of like this, the artery gets bigger. If it's bigger, more blood. So more blood flows to the muscles. At the same time, the arteries going to all the organs, they make them smaller. So that's why there's less blood to the organs and more blood to the muscles. And the body controls that pretty well in a normal functioning nervous system. CRPS is not a normal functioning nervous system. So we change the blood flow, right? Those muscles contract, and now we have decreased blood flow, and now that foot turns all sorts of weird colors, right?
Yep.
So what's controlling that? What's controlling that muscle? A nerve. What's controlling that nerve? The autonomic nervous system.
Okay.
So that dysregulation that people have, that dystonia of autonomic nervous system function, of sympathetic parasympathetic balance, that's a straight up neurologic problem.
Okay.
Now, nerves can be irritated by organs, by muscles, by other things, but still, it's nerves. So all these things that we're doing, the neurologic things, they're addressing that. And as you normalize neurologic function, you normalize blood flow, you normalize muscle tone, because like the swelling that we have, Like the
Mhm.
arteries are pumping blood out. But how does the blood get back? The blood gets back from our toes or our hands through the veins, the blood veins. Well, veins, they only have two layers. They only have an outside layer and an inside layer. They don't have that middle muscle layer that an artery has. So then how does the blood get back from your feet to your heart? Those arteries are more on the surface of or closer to the skin, and they run next to muscles. So if I contract a muscle, it squeezes the artery. I'm sorry, it squeezes the vein, just like when you squeeze on a tube of toothpaste.
Okay.
Now, when you squeeze on a tube of toothpaste, which way does the toothpaste go?
Out.
It goes out the hole, right? It can't go backwards because it's stopped.
Right.
Duh. Our veins are the same way. They have a bunch of one-way doors. And
Okay.
all the one-way doors are pointing toward the heart. So if you take a vein and you squeeze it in the middle, some of the blood's going to try to go backward, but it's going to hit the one-way door that's shut. And so it can only go toward the heart. So as we move around through the day, we're contracting muscles. Those muscles are squeezing on the veins, and then that's pumping everything from our extremities, from our arms and legs back to the heart. Well, how active are people with CRPS?
Not active.
Right. And what's their muscle tone?
Yeah, atrophied.
So do they have swelling?
Yes.
Is that rocket science why they have swelling?
No.
We know it's physiology, right?
Yeah.
So as we restore normal nerve function, we're restoring normal nerve function to the muscles as well. So now the muscle tone goes up, pain's coming down, people are more active, you're pumping better. And there's
Mhm.
another drainage system too, the lymphatic system for all the big chunks that are too big to go into the blood vein system. And everything, again, it just compiles, this very slow in the beginning, but as things begin to function better, then all those things, including discoloration and swelling and cold extremities, that's all
Yeah.
changing because we're changing drainage and blood flow
Okay.
neurologically.
It's very cool that you're explaining how everything works because it kind of like creates light bulbs and it makes you understand better, which I think will be really helpful for people. And I've always thought the temperature thing is very interesting. Like you could take a thermometer and put it on my CRPS foot and it's like 4 degrees colder than my other foot. And that's like such a weird phenomenon in my head. Textbook of medical physiology.
This is the book, big, thick book, that
Yeah.
every doctor has to study. Every
Okay.
medical doctor, every doctor of chiropractic, every osteopath. This is the book this is the Bible of how the body works. Now, unfortunately, most people read this book to pass a test.
Mm.
Oh, okay. I learned how the venous drainage system works. Okay, I passed that test. I don't need to know that anymore, unless you have a CRPS patient or someone that's injured. So most of the stuff that I do, I learned my first semester in chiropractic school.
Thank God that you remember the information that you learned and you keep doing
It's
continuing
the
education
earplugs
to
that,
the
that help.
extreme and you keep it in with your cotton ball. Well, you were talking about like the muscle tone getting better and everything less things as the whole system starts to calm down. Is like physical therapy, PT part of your program as people are able to start moving more? Yes.
Right.
Okay.
You have to take a whole body global approach.
Yep.
You can't
Absolutely.
just work on the muscles. You can't just work on the nerves. You can't just work on the immune system. You can't just work on the hormone. You can't just work on the mental aspect of it. You can't just work on the diet or the sleep or who you're around. CRPS is above all things, it's impacting every single cell in your body and every part of your mental, emotional being. And if you don't address all of it, it's going to be a long, long haul.
You've given me so much information, which is so wonderful. I really appreciate it.
You're
You
welcome.
spending the time with us. Another doctor that we talked to talked about quantum neurology. Is that one of those techniques that you're using?
Yeah, so quantum neurology is amazing. It was developed by a brilliant chiropractor, George Gonzalez. His wife had a spinal cord injury, and he took her all over the place. She was young, like 22, 24 years old, and she didn't have bowel or bladder control, couldn't move her legs. It was horrible. Living in Los Angeles, where there's tons of brilliant MDs, brilliant chiropractors, and no one really could help. And then he took her to some chiropractor that had a laser, and this is back before lasers were legal in the United States. And she got a little bit better, but then she plateaued. And then he's like, "Oh, there must be something about this laser. You know, that guy doesn't have all the answers, but definitely lasers are doing something." And so he said, "No one else has the answer. I'm just going to have to figure it out on my own." So he spent all of his extra time, and he was still in chiropractic school, like his last year. He was going to the UCLA Med Library, the USC Med Library, studying. And what he says is that one night he went to sleep, and then in the middle of the night, everything just got downloaded to his brain. And he woke up and he wrote it all down. And he and his wife are close friends. So he woke up and he just did what he wrote down. And she, made recovery.
Wow.
And he's like, "Well, I have to share this with the world." How do you do that? When you're some young kid and you've got an idea. And so there are a lot of chiropractors and other doctors that give seminars, right? And so he knew this one doctor that was going around the country teaching doctors like, "Hey, take these 10 different techniques and mush them together and you can incorporate them into your practice." And so he showed this other doctor his technique, and that doctor said, "Hey, that's great. Why don't you come with me to all these seminars and you can teach other doctors?" And by the grace of God, I just happened to be in, the first seminar that he ever presented it. And I'm like, that's crazy. Like, this is wild laser beams in people's brains. And I'm like, this is all the bad stuff you always hear about chiropractic. That was my first thought. And then my second thought was, but if this works, I need to know this. And so I spent like 9 months flying all over the country, following him. And like, I don't get it. I don't get it. It's just so, I just couldn't comprehend. And then we were in a seminar in Florida, and he went over the cranial nerves and how to test them and treat them. And this light bulb went off in my head. And I literally stood up in a room of 100 doctors and went, "I get it. I understand." And he just started laughing, like, because I'd just been bugging him for stalking him for 9 months. So he formalized this technique. I ended up being the first person certified in this technique. I ended up being the first doctor of the year, first two-time doctor of the year, ambassador of his technique, the only other person to teach it. It's just a brilliant neurologic rehabilitation technique that plays a major role in what I do. Because of my background, like, I've done a lot of things, but one thing is I've been a chiropractor at 4 Olympic Games, treating chiropractor, and 12 world championships, more than 50 US championships. And that, it was a big honor and pretty cool, but it's also kind of flashy, So
Yeah.
I would go with Dr. Gonzalez to his seminars, and he'd stand up. He looked like he's, 17 years old. He's like, "Hey, I got this great technique with laser beams." And people would look at him like, where's your dad, And then I would stand up and I go, "I'm the Olympic doctor." And then I'd say, "This person was blind and I treated them, they could see, and this person was paralyzed and then they could walk, and this person was in horrible pain." And I would validate his care, and then the doctors would listen to him.
Wow.
And so we went around to a lot of these things. And so in those early days, those first 10 years, a lot of those people that came into to quantum neurology were, I got to play a big role in that. So I was really proud of that.
Yeah, it's definitely something to be proud of. It was like definitely meant to be that you guys found each other and you're able to be there to help him and
Very
validate
true.
him. And absolutely. So if somebody is interested in coming to you, first step is to just contact you through the website, and then
Right.
people reach out to schedule things, talk to you about where you're at and
Right.
when they'd
Yeah.
be
So
able
what
to.
happens is they'll reach out and then we'll schedule the Zoom call. And then I will personally talk to them and hear what's going on, right? Because that's that first step is to really listen and then figure out if I'm the right fit for them and then how they can make it work, assuming that I am, to come and stay and let me have that opportunity to help them.
Something that I also saw I wanted to ask you was, I saw on your Instagram you were talking about scars creating restrictive movement. I have a ton of scars from surgeries and stuff. So
Yeah.
I found that really, whether this is included or not, I wanted to ask you about it.
Yeah. So one of the things that I've studied is a field of healthcare called biological medicine, European biological medicine. And in Europe, this group of doctors developed an alternative medicine different to drugs and surgery. And they ended up, there was a program teaching it in the United States, a 2-year program. And I got to go through that a couple times. One of the things that they talk about is really fascinating is that, first of all, we have messages traveling through our nerves, but we also have messages traveling through our skin. It goes slower, but it's going cell to cell to cell. And I don't know what those messages are. I don't know what they're saying, but they're saying whatever they're saying. But when they hit a scar on their way up to the brain to deliver their message, the scar can change the message to anything.
Wow.
And I'll give you a couple examples of that. So this is what the MDs in Europe figured out 50 years ago. And then they found that if they neutralize the scar, like they rubbed on the scar or they, injected it with lidocaine and, hit it with lasers or did whatever to make the scar tissue more like the normal tissue, then the signal would just go right through. And then whatever the problem was with that block signal would go away. And a good example is, they're in hospital settings and they're treating women with cancer. And let's say it was a type of cancer that normally is very successful, like with chemotherapy. But they had a group of women that were not responding to the chemotherapy. And they found, they have these scars, maybe it's a tonsil scar or a scar on their skin or an episiotomy scar or your belly button, right? Your umbilicus, the first scar we all get in life. And I don't know who thought of it or how they came up with it, but just someone said, let's treat the scar and see what happens. Well, when they treated all the scars that these women had, then they started suddenly overnight responding to the chemotherapy.
Wow.
So this is what I learned in sitting in a classroom. So the way that I am, as you saw with my first response to quantum neurology, is I'm like, makes a nice story, but I'm going to tell a patient they have to pay me to do that. I can't do that unless I know for a fact that it works, right? At least I can't. Mm-hmm. So I had this woman who was a long-term patient, and she came to me for whatever her issues were, and then she would just come for checkups every 2 or 3 or 4 months. And then she disappeared for a couple of years. And then she calls up one day and she's like, Dave. She's older woman who's very informal, right? Should be Dr. Pascal, but Dave, I want to come see you. Like, all right, Catherine. So she comes in, she's a little ornery, and she said, I hurt my shoulder. I said, like, where have you been? She goes, I fell down some stairs. I broke my shoulder. I had to have a cast, rehab, all this stuff, and now I'm done, but I can only lift it halfway up. And I want you to, I did 9 months of physical therapy. They could only get it halfway up. I'll give you 2 visits to, okay, thank you. And she was wearing shorts, and I noticed that she had a scar on her knee. So I'm like, Catherine, when did you get that scar on your knee? And she goes, oh, my knee had been giving me problems. So when I did the shoulder surgery, they did knee surgery too. I'm like, okay. And I go, well, how's your knee? She goes, my knee's great. My shoulder's halfway. I'm like, okay, let me check something out. I said, go ahead and raise your arm up. And she could only go halfway. And then I took my hand and I literally just touched her scar on her knee. And I said, okay, now try. She did this all the way up, completely. I was like, wow. I guess that
proved it to
European
you.
biological medicine neurotherapy guys are right. So I took out my laser. I took some wheat germ oil. I rubbed that into the scar. I lasered it. And then 2 things happened. All of her shoulder pain was completely gone. She had 100% range of motion. 1 treatment. So I know for a fact that scars can have a major impact.
Wow.
And you don't know how. It could be, it's like with the case of the breast cancer, it's impacting the immune system. With the case of Catherine, that signal through that scar in her knee obviously said 2 things. Hey, tighten up all the muscles in her shoulder so she can only lift it halfway up, and fire all the pain to her so she also has pain. How do I know that was the message? Because when I treated the scar on her knee, her pain went away and her motion came back.
So, is that something that you've done that you've added in with CRPS patients if they have a bunch of scars?
Yeah, of course, because remember, global approach.
Right.
So one day I take my notepad and I go, this is scar day. Let's document all your scars, and it could be, doesn't have to be a big, long scar. It could be a little tiny scar from when you fell on the playground in 3rd grade and now you've got a scar on your chin, or you had surgery, So we test all of those to see if they are what we call active scars, if they're impacting the body. And if they are impacting the body, then we need to treat them. And some things I can directly treat. Let's say you have a scar on your knee, then I can rub that and laser it, fine. But if you have like an episiotomy scar, I don't think that's appropriate for me to be working on. So I'll say, here's some wheat germ oil. You need to go up and down long ways and crossways and work on that scar. So some things I directly address and will laser it, when you come in the office. So some things I directly approach and some things we appropriately indirectly approach.
Right. So it's extremely interesting. Never heard of that before. So it just was very...
Awesome. Yeah, it's called neural therapy.
Neural therapy?
Yeah. And maybe if you Google like neural therapy or neural scar therapy or European biological medicine scar therapy or bioregulation neural therapy, then you'll find lots and lots and lots of research.
So much research to do. So much interesting information.
And that's the advantage of experience. Because not only have I been studying for 50 years and learning all these different things, and I mean, I'm still doing my 100 hours of seminars a year, even though I'm 65 years old. And I've been doing this a long time because I'm still trying to get better and be that doctor for my dad, right?
Yeah.
And then experience. Experience is the best teacher. And I've been fortunate to have countless CRPS patients, I would say that I've had as many or more than just about any doctor around in terms of actual numbers that I've been able to help. So And then all those numbers and all that experience lets me help more people. Right?
Absolutely. Is there anything else that you can think of that we didn't cover that you want to talk about?
I mean, we covered a lot. I think the one thing we didn't talk about is a lot of the people that I talk to, like when I do a Zoom call, they go, "Oh my gosh, that was amazing! Everything you said," just like you're saying, like, "Oh yeah, I didn't think about that," and and that all makes sense, and that's fantastic. But I've only had CRPS for a couple months, and I'm just gonna wait and see, or I'm just gonna go to my local PT or Chiro or MD, because most people in the beginning stages, when they first get CRPS, they think it's like every other problem, every other disease, every other condition that, okay, this is horrible. Yes, it's awful, but I'm only going to have it for a couple months. My body's going to heal, and then I can get on with my life. That does not happen with CRPS. There is no spontaneous remission. There isn't, oh, I'll go get 3 adjustments and 4 PT sessions and get some ketamine and then I'm good. That doesn't happen. CRPS is insidious, progressive, aggressive disease process. And your best chance of getting it fixed is aggressive care in the very beginning. See me in the first month's better than the second month. The second month's better than the 6th month. The 6th month better than 2 years down the road. 2 years is better than 5 years. 5 years is better than 10 years. But the sooner that you can get efficacious care, effective care, that's your best chance of resolving it in the least amount of time. So the mindset though that people have is, well, my insurance is going to cover it, or you're too expensive, or it disrupts my life to go, or it's only going to last for a couple months, maybe 6 months, and then I'll be fine, because they've never had it before. So I understand why everyone, I'm sure you did too, thinks it's going to be short. It's horrible, but it's going to be short. And that's just not the truth. The truth is it's going to be bad. It's going to get worse. And it's going to cost a lot more money the longer you take. Because not only does it cost you money, but it costs you your quality of life, your relationships. Many families are completely destroyed because you're in horrendous pain. It's all consuming, not only for the person with CRPS, but everyone that loves that person.
Yeah.
And so I wish there was a way for people to believe me when I say, yes, you've only had it for this short period of time, whatever that is, but you need to do everything that you can to come in as soon as possible, because a year from now, you'll wish that you did.
It's hard enough to try and accept a condition that they say there isn't a cure for. There isn't a cure yet for, but accepting it that it really, like, it's hard for yourself to accept it, but then it's hard for other people around you to accept it too. They always say, oh, it'll get better. Are you better
Right.
yet?
Or they go, oh, you can't really be in that much pain.
Yeah.
Look, I see you smiling. You just smiled. So really, are you really in that much pain? Is it really that bad?
Right.
Like they have
Right.
zero idea.
People just can't understand. So having a place that does understand, that's willing to help, that wants to help, is desperate to help you feel better. And everyone I've ever heard from always says the sooner the better. And it really is something that it's hard to accept, but you have to like accept that you have to do what you can, or it's going to get worse or not any better on its own.
Unfortunately, that's the case.
Yeah.
And we're always looking for, there's a reason why I have 32 or 35 different treatment modalities, because I'm always like, I need something better, something faster. I'm on the phone talking to my colleagues. Oh, well, does that thing really, do you have something new, that you're using on your other patients? Or, it's not like there's 10 doctors I can call and ask about fibromyalgia. I have to find these outside,
Yeah.
And so I'm always looking, always searching, and always buying more things in an effort to shorten that, recovery time.
Yeah. I think this is probably, from everything you said, kind of a self-explanatory question, but I always ask people why they decided to become a resource for the foundation. And I mean, obviously, we know your story and why you do everything, but it's a question that I feel like I need to ask everybody. So, yeah, why did you decide to become a resource?
Yeah, well, I mean, I love what you're doing. I appreciate what you're doing. I am with these patients all day long, every day. I see them when they're crying, crying, crying. I see their family members, the looks on their faces, in the treatment room or in the lobby. I'm there when they're laying on the ground having convulsions and horrendous pain. And I've seen that for decades. And I talk to my colleagues and they go, "What do you do?" I say, "I see CRPS. These people are in horrible pain." They go, "Oh, yeah, yeah, yeah." Like the no one that gets it. So when I find a group that gets it, that understands this community and wants to support this community, I mean, that's why I wake up every single day is to serve. And so to align myself with others that are doing that is a blessing.
Thank you so much. It's wonderful to know that you're there and that you're part of the community, and that I can't thank you enough for sharing all your information with us. We really, really appreciate you. If you discover something as you are going and learning all you do around the world, you discover something new and you want to share it with the community, please reach out. We'd love to do any number of podcasts with you. If you want to go in depth about one topic or you have any ideas you want to do, we want to get your information out. So please just reach out.
Sure. Well, thank you. Love to do that.
So thank you so much. It was really a pleasure to meet you.
It was very nice to meet you too. Thank you for allowing me to share what we do and getting that word out.
Kimberly, thank you for delivering another amazing episode. And Dr. Pascal, we cannot thank you enough for taking the time out of your busy schedule to sit down with us today and share with us all of your amazing insights. We can't thank you enough for what you've done for the CRPS community. It is truly amazing to see how much of your life and time you have given to making Warriors' futures brighter. You are exactly what Warriors need. It's so comforting to know that people like you exist. So thank you so very much. If you would like to support the CRPS Warriors Foundation and our podcast, please text CWF podcast to 53555. We are adding an extra episode into our regular series, so episodes will be released going forward on the 1st, 10th, and 15th. And we also have started our international podcasts. These will be released once a month on the 25th, so make sure to tune in for those too. Our next support group is on July 3rd. You can find the registration link for this by visiting our events tab on our website or our Facebook events. We are always here to support you in any way that we can. You can always find us on our website, crpswarriorsfoundation.org. You can stay up to date with events and episodes by following us on social media. Thank you for enjoying our double-digit episode with Dr. Pascal. We will see you again on the 10th.